the baby's got good tone because it's moving, which is
Yes.
great. Good colour, nice and pink. It's the 1 minute Apgar there. So I'll just assess the baby's heart rate. Good. Okay, that heart rate's about 140, which is
Excellent.
great.
And can you count the
Yes. I can see and feel the respiration.
what do you think about the colour, Joanne?
The colour's nice and pink, which is what I'd expect. There's some blue coloration of the hands and feet, acrocyanosis, which is quite normal.
Where would you put the Apgar score at 1 minute?
I would give the baby, probably I'd give the baby a 9, because the colour, because it's not a fully pink baby, then I would give, take off 1 mark for the colour.
Excellent.
Yes.
Excellent. So that's 2 for heart rate, 2
Yes.
for tone,
Yes.
2 for response to stimulus,
Yes, since their baby's moving.
and 1 for colour.
Yes.
Well, this baby's not adapting very well. It's been born for 3 minutes now, and you can hear that it's having trouble breathing. It's really needing to use all those muscles, and it's making an expiratory noise, what they call a grunt. It's also a bit floppy. It's not really got good tone.
Excellent.
Although and it also has a bit of cyanosis. This baby is not transitioning well and will probably need some additional support. It may just need a little bit of additional time, but I think also its respiratory rate is really higher than normal.
So the baby's head has just birthed, but it's now retracted back against the perineum, so we have a turtle sign. So I'm going to try to deliver the shoulders without any success because the baby's shoulder is caught above the symphysis pubis. So at this point I'm going to call for help urgently. And then I'm going to evaluate for an episiotomy, which I'm not going to do at this stage because this is a bony problem, not a tissue problem. I'm then going to elevate the woman's legs, and I'm going to ask the partner of the woman to hold her legs right back so that her knees are to her nipples, to widen the pelvic outlet as much as possible. And using that manoeuvre, I'm going to try and deliver the head again without any success. So at this point, my assistant has arrived, and I've asked her to do suprapubic pressure above the symphysis to try to adduct the shoulders. I'm going to try to deliver without any success. So after 30 seconds of trying these manoeuvres each, I am now going to move to do the enter manoeuvres. So I'm going to put my hand in posteriorly and work it up to the posterior, to the back of the anterior shoulder, and I'm going to try to rotate the baby without any success. I'm going to put these fingers in and do a reverse wood screw manoeuvre without any success. At this point now I'm going to try a reverse manoeuvre to try to bring the baby back the other way. There's a little bit of movement, but not enough. So I'm now going to try to remove the posterior shoulder, the posterior arm. So I'm going to go in and try to locate the humerus and sweep it over the baby's chest, and here it comes actually. Here comes the posterior arm and shoulder. So the whole baby will now birth. Oh, and there it is. Success. Now, breathe, 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 breathe. Really well. That's it. Just breathe it out. A little bit more. A little bit more. Okay. Breathe. Keep breathing. Keep breathing. The head's out now. A little bit more.
Is it out? Is it out?
The head's out now. You've done a fine job there. Beautiful. And here comes your baby. Well done. Well done. Well done.